Hello, everyone. I am Terry Sir. I am the Chief Total Rewards Officer in Human Resources. Thank you so much for joining us today to learn a little bit more about how we can best unlock all of the family processing at Colorado State University. I am pleased today to introduce your two presenters, Jackie Swaro, if you want to give a little wave, Jackie. Jackie is our benefits supervisor, so she is a leader of the benefits team. And then Kaylee McKenna is our payroll manager. Thank you, Kaylee. So with that, again, just really appreciate all of you joining in today. We had a wonderful session yesterday in the Laurie Student Center and are hoping that this one and the conversation that we can have back and forth with all the great information on where we're at with family processing today and where we still hope to go in the future. That would be wonderful. So what we've done for this meeting is we're encouraging everyone to just unmute when you have a question. We do have a couple breaks that Jackie and Kaylee will pause for so that you can jump in, or if you have an urgent question you want to ask right away, just unmute yourself and try to jump in, and Jackie and Kaylee would be happy to take those questions as we go through. We're going to try to stay on track so that we've got an hour devoted to the webinar. Again, Brittany is taking care of recording this for us so that we will be able to post this out on our website. So just be aware of that. We will be making this available to all of our HR community members. And with that, I think we're ready to start. So Jackie, go ahead and take it away. Thanks, everyone.
Awesome. Thank you so much, Terry. And thank you all for joining us. And I hope you have your cup of coffee or your caffeine for where we're going with this afternoon family presentation here today. So what's going to be a little bit different about the way that we're going to approach this presentation in a little bit different than what we've done in the past. So the other ones have really been focused on the family program, what the eligibility looks like, what the criteria might be. And this one, we're going to change gears a little bit to focus more for you all as department partners and professionals, and the processing and kind of the behind the scenes of family. So really what you'll see on the screen today, we're going to do a quick overview or review of the current system for processing. Hopefully you'll learn a little bit more about best practices and improvements for family, and understand the tools and resources that are available to you, in addition to the resources that we have here in HR, our benefits team and our payrolls team, to help you through any of these family questions that you have, and that for our employees as well. And then the last place that we're going to end up with is a little bit of collaboration. So the feedback from you all, understanding and hearing more from you all, communicating, and what we can do to review our processes and maybe make this process a little bit easier for all of us. So we've had a lot of enhancements and improvements as we've started this back in November, December, and as we've proceeded forward. So continuing to look forward to what we can do with this program. So the first slide we're going to start with, I'm not fully going to go into this. It's just a really quick overview of the family facts. So of course, family is available to all employees who live and work in Colorado, and the benefits are calculated on a sliding scale up to a maximum weekly amount of $1,100. Both the weekly maximum and the average weekly wage, which these calculations are created from, are indexed annually. So you may see some modifications to that maximum in the future. Again, eligibility is up to 12 weeks per year for an employee to take care of themselves or a family member for those options that you see below. The one piece that I will pull out a little bit of that list is for complications from birth. So just a quick clarification on the complications piece of it is that's not always going to be considered just a C-section. In a lot of cases, it has to be something that's going to impact or be a big impact to the birth parent or the child, for it to be considered to be a complication. And the duration of that, it could be up to 4 weeks, but it's also going to be the maximum of what a healthcare provider communicates is the need for those complications. So the other clarification on the state's part of it is that if a person is going to apply for complications from birth, they must do so within 6 months of the date of birth. Otherwise, outside of those timeframes, they don't consider that to be the complication related to the birth of a child. So then the next pieces we're going to see here. So family is a benefit that an employee can apply for, but it's not mandatory for an employee to apply for family. They can simply use their accruals, but there are certain timeframes that if they have a change of mind and they do want to apply for family later, they do have to do so in a period of time, which we'll go through in another slide or two. And then the last bullet there you'll see, in which you've already heard, I'm sure, is that the CSU employees do apply through CSU and not through the state of Colorado. All right, so the next slide we're going to go over is just how family coordinates with other leave programs. So the first one we're going to talk about is FML. So our department HR liaisons are still responsible for initiating FML paperwork for their employees. And in most cases, the family reasons and the FML reasons are going to coordinate together. There's only a few different reasons that FML does not comply with family. So in almost all cases, you'll want to make sure you're still initiating that paperwork. The FML forms are separate from family forms, so you will have to obtain new medical documentation and complete the notice of responsibilities and the designation notice for each employee. And those should be kept as a copy within your departments, but also forward a copy of those directly to HR and the benefits team. For an employee's own serious health condition, that should follow the same FML guidelines that you've had previously, that a fitness to return should be obtained in most cases. A little bit different for birth and care and bonding and those types of situations, but otherwise it is recommended to request a fitness to return. Those documents for the fitness to return don't need to come directly back to HR. Those can stay within the department. You can send a copy, but essentially for HR to release the employees, we're not doing that portion of it. That's still going to occur within the department because you all know best about your employees. If there's any restrictions, can they be released in a full-time capacity? So those should be submitted from the employee directly back to the department. And then the last bullet you'll see under FML is the paid FML for classified employees. That can be used independently from family. The state has communicated that that portion can happen. However, in most cases, it still should be coordinated with family, and there has to be FML entitlement available for paid FML to be used. So in like I mentioned, in most cases, it should still run concurrently, but a person can have access to paid FML without applying for family. All right, the next one is parental leave. So parental leave must be used in conjunction with family and used within the first 15 days. So where this might change a little bit from what you've been used to with parental leave in the past is that 15 days was calculated as 120 hours if those employees were full-time. So now it's still going to be the same 15 days. However, it's only going to be considered top off to family. So if a person's elected top off is, let's say, 2 hours on top of family, you'll actually submit for reimbursement. So same process that you've done previously. 2 hours for 15 days versus 8 hours for 15 days if they would have been full-time. An employee also does not have to elect the top-up option with family for parental leave purposes. So we'll get into the other leaves and how that coordinates with them. But otherwise, when you submit the application for reimbursement, you'll include those initial 15 days. And then for birth parents, you can also include the top-off amounts for sick and annual leave that's used during that period also. So the maximum that you were used to previously was that you could submit up to 480 hours. Now, in most cases, the very maximum is probably about 240 hours. because again, it's just that difference or that top off of the family amounts. And then the parental leave application, another enhancement that we've worked through is we have created an online application for that reimbursement process. The parental leave app is still continuously being improved, and we're walking through different options and what is most simple and most understandable. And so that is still in progress, but you can use it. The applications are on the website for you to submit the parental leave for reimbursement. All right, the next leave that we'll talk about is short-term disability. So for our faculty and administrative professionals, the short-term disability does run concurrent with FAMLI, but the same rules exist under the plan. So there is a 10-day waiting period or the exhaustion of all of their sick and annual leave accruals, whichever occurs later. So in a lot of cases, an employee may not be eligible for short-term disability because they have enough accruals potentially to meet that waiting period, because they're just using little top-off amounts in conjunction with FAMLI. They'll have accruals that are going to take them basically a longer period of time. So our benefits unit will review each situation, and if there is a need for short-term disability, we can reach out directly to the employee or to the department that a person may be eligible for that plan. Then for state classified employees, theirs works a little bit differently in that theirs is considered to offset FAMLI. So instead of running concurrently or being paid both or being made whole in those situations, short-term disability, when they apply for that program, they are going to take the amount of FAMLI that they're eligible for, or the amount that they could be eligible for if they don't apply for short-term disability, or I'm sorry, if they don't apply for FAMLI, and that could offset the entire amount for their disability program. So for example, since the state's short-term disability plan is a 60% income replacement, if a person's FAMLI calculation is more than 60%, then it's essentially going to offset 100% of that short-term disability. Now, it's possible that a person could apply for short-term disability after their FAMLI entitlement and still have some eligibility where that's not offset at that point. But for those to run concurrently, in most cases, it's not beneficial, as it completely gets wiped out essentially from the FAMLI amount. But again, the same rules apply for that program as well. There's a 30-day waiting period, and leave accruals must be used through that waiting period. And the application must be within 180 days from the date of disability that's noted by the healthcare provider. All right, now the last section for leave is going to be just leave accruals. So sick leave, annual leave, when they're used in conjunction with FAMLI, they're going to supplement that partial family wage and be considered top off. So an employee does have to elect to top off and use their sick and annual leave accruals. So that is a question that's in the application, and it's a simple just yes or no, and then we top off when we process, or don't when we process that application. Now, if an employee chooses to apply or chooses to use their accruals without FAMLI, again, FAMLI is not mandatory. It's a benefit for them, but a person could just continue to use their own accruals and not apply for FAMLI at all. And then the same holds true, as I mentioned previously, the classified can use that paid FML without those the FAMLI accruals. Now, one thing I will mention as far as a consideration for using leave accruals, especially for those individuals who are para participants or contribute to the para retirement plan. While a person is on FAMLI, they are essentially not receiving, it's not essentially, we'll go into that too as we get a little bit further about deductions, but they would not be receiving any salary from the university under the family plan because deductions are not taken and sent to para from family wages. What that means is that a person could essentially not be receiving any service credit during a period in which they're on family, which could impact someone's eligibility later. So essentially when a person could be eligible to retire through para, if their eligibility changes with having leave without pay during those periods. So if they are topping off and using family, a certain portion of those top off amounts, those are still going to be paid in the regular pay cycle, which will have para deducted from them. But para basically stipulates that if a person is receiving at least 80 times minimum wage of their income, they will receive a month's worth of service credit. So if a person is not obtaining or meeting that criteria with their top off amounts, they won't receive the month service, or they may receive a partial month service based upon those top off amounts that are coming in. All right, I think I see maybe a few questions coming in here. So we can stop at this point. If you'd like to ask your question verbally, we can definitely, you can unmute yourself if you'd like to ask that question, or raise your hand and we can do it that way, or go through the chat here.
Jackie, there. Oh, I was
go ahead.
sharing your screen so I can read out of the chat if that's easier. There's two folks with the same question, and it is, can folks use parental leave with just their sick and annual leave accruals without applying for family?
Great question. So an employee may use their own sick and annual leave accruals without family, but the parental leave does need to run in conjunction with family. So if a person doesn't apply for family, they're not eligible for the parental leave benefit. So great question.
And the other question in chat is if DCP contributions continue on family.
So those are not retirement contributions at all, are not deducted from family, but we do have a few slides later once we get to Kaylee's portion that will speak to that more specifically. All right, from there, I'm going to pause again real quick in case anyone needs to or wants to ask any questions. If not, we'll proceed from here.
Paula. I think Paula has a question. Paula, do you want to unmute? Oh, her headphones died. And then just a clarifying question while we hopefully get Paula back. So basically the 3 weeks of parental leave from the university that we're accustomed to are now done through family.
Yes, that is correct. So the parental leave program still exists. It just, the partial amount comes from family and part of it comes from parental leave. So it does still provide that period and the income replacement for an employee to be home with their new child, whether that's a birth or adoption. But the parental leave hours are basically now embedded kind of within the family program. I think I see Paula's question. So her question is if an employee exhausts family and they now want to apply for short-term disability, are they eligible for the entire 6-month standard benefit? Great question. So generally what happens with a short-term disability claim is that there's a data disability that's provided, underwritten, reviewed by UNUM and specific for the state classified employees. They do all of the underwriting for that plan. That data disability is usually when they consider kind of a start date for short-term disability. So let's just say, for example, a person's surgery date is on X date. That is very likely the date they're going to consider the data disability. So that clock, in essence, is going to start that day. So if they've already exhausted their family, they'll probably be essentially approved an offset back to that initial time frame, but then they're only going to receive the 3 additional months under that program, assuming their duration is going to continue that long. So it's not going to be 6 months in addition. It's essentially the difference between their data disability, what they were already paid through FAMLI, and what their approved duration is.
All right, I think we're caught up.
Okay, I think, oh, I see one, there is one more question. When should we submit the parental leave reimbursement requests? Will you notify us once the reimbursement has been processed? So the parental leave application can still be submitted within 30 days of the end of leave. So essentially within 30 days of the employee returning to work. And that allows us to verify the leave that was used, and the Time Clock Plus reports can match up with any sick and annual leave accruals that might have been used. And then we'll do, in most cases, the calculation for the parental leave and what that reimbursement amount is. And we can, and certainly work into our processes, or look into working into our processes about the notification once those have been submitted and processed or reimbursed. Otherwise, you're always welcome to check in with our teams too. We can do a verification and when those applications have been processed. All right, I think we are now, thank you, Brittany, all caught up. Okay, so I'm not going to spend a lot of time on this slide. Essentially, just kind of the walkthrough of how we get from application to the paid leave. So the one thing I will call out is number 2. You're going to see that the CSU family claims must be applied for within 30 days of the first date of absence. This just allows us to ensure that we're processing and paying these timely within a time frame that the employee is out or has begun taking their leave. The CSU benefits team has up to 14 days to review a completed application. And the complete portion is really because of the documentation that's included. So we might receive an application, but unless we receive accurate and complete medical information, that claim is going to be considered to be complete. And then that review of those processes goes through for approval, hopefully in most cases. And then the family is paid on the 1st and the 15th of the month after their approval dates. So I think that's been one of the best enhancements and improvements that we've had through this process is the change of paying those consistently on the 1st and the 15th. It did 2 things for our teams. It did one thing where there was a consistent pay period for those to be processed at a particular period of time. Our payroll unit was paying claims every single day based upon those dates. And so this really allowed them to have a more consistent process when those claims were paid. In addition to that, it also allowed our employees to know and expect when those claims are going to be received. So great enhancements there. All right, this slide is just a process example of basically how we can get from one period or from the beginning of the application to pay date again, kind of similar to the previous slide, but a little bit more specific about how an application might take its path to get to payment. So really the biggest thing that I'll call out on this one is on the 3rd bullet, you'll see once they've applied, they have applied on the 26th for time off to begin on the 29th. And that 3rd bullet essentially has the final medical documentation that's required for all or most of these claims is received essentially a week later in this example. And then the time frame that it takes to get from the benefits team down to the payroll team, the calculations that all need to occur, plus all the notifications that go to the employee, plus the departments, take a couple of business days at minimum. And then all of that is communicated to the payroll unit with some time to process and get all of the verifications and the actions to be put in on the department's end as well to get us to a final result on the August 19th date as all the communication and the applications approved. And because we're beyond the 15th of that month, the payment in this situation then rolls to a September 1st date. So kind of showing just a series of dates here and how the application can take some time in situations to get to that paid point. All right, so this may be a notification that you've seen from your employees, or maybe they have forwarded it on to you just as a communication piece. Just the employee notification. So it's really going to talk a little bit about their approvals, what their amounts are, what their dates might be, what type of leave they applied for. And we've continued to update and enhance this notification going forward, just to make it as clear and simple for the employees to understand and really see the important information that we're trying to convey to them. You'll see that orange bullet under number 3, which really calls out that when an employee is receiving both regular salary and family payments based on timing of the actions entered and their approval dates when they've applied, a variety of different things, that those future salaried paychecks are reduced by those family payment amounts. So Kaylee's going to talk a lot more about that in some future slides, but just that's called out to show that we've put a lot of emphasis on that communication to the employees. And then this slide is going to be maybe a little bit more that what you've been familiar with and have seen is the department notification. So once we've made a final determination on that family claim, this will be the information that goes to you all as department professionals and guides what type of entries and the amount that goes into each of the systems depending on employee type. The left is a example of a continuous leave, and the right table would be in exchange for the family entries that are there on the left, but that is just a day-by-day calculation of those intermittent hours for someone who's been approved for a inconsistent or unknown type of absence or leave days to be used. All right, so these are the fun part. So these are our coordination examples and our entry examples. So really a great image of where the entries need to be put for each employee type and different types of situations. For this particular example, this is going to be an administrative professional who has applied for continuous leave and they're using top off, so their own accruals, or maybe even parental leave in a situation like this. So you'll see the top amounts for their weekly benefits. It's going to break down the amount that they're eligible for family. And then there's equivalent number of family hours and top off hours that are essentially going to be accurate or equivalent to the amount of family that they're eligible for, in addition to the top off amounts, which are going to make them whole. So that first line that you'll see there is just FML is going to run concurrent again with family, and then just a very basic overview of the family entries plus the top off amounts. In this case, the assumption is that the employee's been approved for 2 weeks of family. So down below, it'll show the breakdowns of each entry. So because this person is an administrative professional, the Oracle entry is equivalent to 6.42 hours, and that's going to be entered every day for 2 weeks. Then the family amount is going to be entered into Time Clock Plus at the equivalent of the day that they used it. So that's going to be a little bit different than maybe some original communication to you all as a department. But essentially, in the beginning, we're having you also enter in the 6.42 hours into Time Clock Plus for family. But for accurate tracking, we made the modification to have a person enter exactly the amount of hours that a person is taking per day. So in this example, it's going to be 8 hours of family gets entered into TCP again for 2 weeks. Then the next line is the TCP top off. So just the 1.58 hours, again, every day for that 2 week period. And then the time clock plus, because this person is eligible for FML as well, that one's going to mirror the family entry at 8 hours per day. Okay, whoops, I went too far. All right, so this next example is going to be very similar to the Admin Pro example that I provided previously, but you'll see the difference is going to be down on the third line under TCP is paid FML. So we're going to assume that this person is using paid FML as the top off amount, but because PFML calculates both the paid amount and the FML amount in Time Clock Plus, we still need an offsetting entry for the rest of the FML. So instead of entering 8 hours of FML into Time Clock Plus, that's going to be equivalent to the family hours of the 6.42 because that calculation is now separate. And then we'll have you put an entry into Time Clock Plus for paid FML at 1.58. So now we have an equivalent of 8 hours of entry for family medical leave and 1.58 hours of the paid portion, which is also the top off. Okay, and then this final example that we have here is someone who is using family intermittently. So the intermittent time is calculated and it's prorated by day, by hour, whatever that duration might be. In this situation, it's going to assume that a person is using 6 hours of family per day on the day that they have time off, and then they're working the rest of the week. So same example that this is going to continue for 10 days, but you'll see that in the first 2 days, they're using family. Then they're going to work for the third and fourth day and continue that throughout their claim duration. So the changes that this is going to make is that that Oracle action and the Time Clock Plus action are going to be prorated based upon the amount that they're using it. So instead of the 6 hours or the 6.42 hours, I believe from the previous slides, their prorated 6 hours per day is going to be now equivalent to 4.81 hours per day. And that's why you see the change in that top Oracle action. And then the Time Clock Plus will be 6 hours based upon that time that they're using since it's not full days. And then the top off also has a prorated entry, which is now equivalent to 1.19 hours. And that's going to essentially make them whole between their work time, their family amount, and their top off hours. And then the FML entries should mimic their family entries into Time Clock Plus. So I think I'll stop here and see if there's any questions about the examples. All right, I don't think we have any questions. Oh, there might be one thing in the chat. Nope, we are good to move on. So this is where I'll turn it over to Kaylee and let her tell you about the payroll processes. Thanks, Kaylee.
Thank you, Jackie. Oh. Can y'all hear me?
Yep, sounds good.
Okay, thanks, Brittany. Thank you, Jackie. All right, so family application has been approved. What happens next? How does the employee get paid? Benefits will notify payroll of an approved application. We're going to review the employment category to make some determinations on what is needed before we can make a payment. We'll look for the Oracle Family Leave Without Pay action if that's warranted. We'll verify the next pay date that the payment should be processed on, again, either the 1st or the 15th of the month. We'll make the determination. We won't make the determination, but we'll review the documentation to determine whether the employee is topping off with leave accruals or not. We'll process that payment, and then we will confirm that the correct deductions are being taken from family payments. If they are in a continuous family program, we will then make an adjustment on their regular pay to offset any family payments that have been processed and received. And then we'll also talk a little bit about if an employee who has been receiving family payments separates their employment from CSU and what occurs with any future family payments that were scheduled. All right, so the notification that we receive from benefits is going to include the employee's Oracle ID number, their name, their employment type. They'll also provide us with the average weekly wage, the family average weekly wage, whether they're topping off or not, the hours that are related to top off, the hours that are related to family payments. They'll give us the correct first family pay date and the family wages to be paid. If an Oracle action is required, and that would be for our salaried employees on continuous family payments, for faculty, administrative professionals, postdoctoral fellows, and state classified employees, we're going to look for the Oracle action. We won't process a payment until the leave without pay family Oracle action is received in payroll. And one of the enhancements we did make early on in our family processing was to have those Oracle actions reach payroll once they are submitted. There are no additional approvals necessary. They come straight to payroll. You're also going to want to make your entries in TCP for those categories. For graduate students, assistants, grad teaching assistants, research assistants, you're going to want to make sure you put your entries in TCP. That would be the same for our hourly paid employees, including state classified, hourly, non-student hourly, and AP hourly. Thank you. The Oracle action, when you submit one, your the reason Nick provided us with a specific one for family entitled Leave Without Pay Family Leave. That's your change reason for family Oracle actions. And then in the creator comments, it would be nice if you would reiterate that it is for family, and then you would provide the information as exampled here with the information that you received in the notification from benefits. All right, after the payment is made, again, payroll will confirm prior to releasing the payment that only federal tax and Medicare tax have been deducted from family payments. Okay, like we've spoken about, those payments are made on the 1st and the 15th. There could be a delay or a variance from those days, dependent on if they fall on a weekend or a CSU holiday, or if we're in the middle of processing a regularly scheduled payroll. We cannot make the system limitation at this time. We cannot make manual payments when a regularly scheduled payroll is processing. There are times when our family approved recipients may receive more than one family payment. And this would occur if there's been a delay or a holdup in the action submission. We've had folks that maybe were approved at the beginning of July and we're already past the 1st of August. They may receive their first 2 payments on August 15th, or it could be they were approved in June and we're still waiting for the action. All of those payments that were scheduled between the time that they were approved and the time that we received the action will be paid at once when the action is received. They are sent direct deposit and should reach the employee's bank account within 2 to 4 business days from the 1st and 15th. Thanks, Jackie.
Yes, sir.
Okay. This is a statement of earnings, which are in Oracle. You can see under the earnings side that it's very clear when you're receiving a family payment, that is the element or earnings code. The only thing that is deducted from a family payment is federal withholding tax or Medicare taxation. There are no benefit deductions, there are no retirement deductions, and there are no wage withholding orders that will come out of a family payment. All right. We've made a family payment on someone who's earning family payments continuously. And because family is not in addition to regular pay, it is a partial income replacement wage, we have to offset those earnings by adjusting employees' regular pay. Once a family payment has been processed, dependent on your category, you're going to see, or the employee will see, a leave without pay entry equaling the family amount coming out of their regular wages. This illustrates a family payment of $1509.26. They would see in July 31st on their regular pay, a negative leave without pay in the same amount of $1509.28 if they had received that family payment prior to July 31st. Okay. When they are not topping off their regular pay during the month, they will receive their family pay. We will make the family pay adjustment as a leave without pay. And we will also make an additional leave without pay adjustment to zero out their check. If they have benefits that normally are taken out of their regular checks, those would be invoiced to the employee to cover any months that they have chosen not to top off. For graduate assistants, they're not eligible for leave without pay. So we are not looking for an action for graduate assistants. Once they are approved, they will start receiving their family payments as soon as possible, whatever the next pay date is listed on the notification that payroll receives from benefits. But because they're not eligible for leave without pay, that counterbalance entry is going to look a little bit different for our graduate assistants. They're going to have a negative retro salary entry to offset the family payments that they receive. All right, we've got an employee who is currently receiving family or scheduled to receive family payments, and they separate their employment from CSU prior to receiving all of the scheduled family payments. payroll will make one final family payment encompassing any future payment that's scheduled family after all of their regular pay has been processed. So for example, someone currently is receiving family payments. They've been receiving them from June and it goes through September, and they're going to leave us on August 16th. They've received all their family payments up through the 15th of August. They're going to get their final pay in August 31st. That will recoup as much of the family payments that we've made. And then after that, and their bills are paid, after that payment is processed and complete, we will pay any future family payments in one lump sum that may go through September or however far they go. Like I said, any recoverable family payments will be included in their final regular payout. Otherwise, if we're not able to recoup all the family payments that we've made based on their claim dates, it can and create an overpayment, which will be processed like any regular overpayment. Payroll will calculate the numbers. We'll reach out to the department, let them know, and you can reach out to the employee of the overpayment. Okay. I think we've had a little bit of confusion. So we on the leave without pay entries. So we asked Nick to work on this for us. And one of the improvements that you'll be seeing starting this month, we're very excited about, rather than putting in our regular leave without pay entry for those counterbalance family payments, we are now going to be using an element that shows up as leave without pay hours family. Very distinguishable then for family payments versus regular leave without pay. And for our state classified, their element to counterbalance family payments is going to say leave without pay hours with. So we're super excited to have that implemented. Hopefully that will help the employees to understand the counterbalance payments and their regular leave without pay if applicable. I think, okay, time clock plus. Right. I'm just going to go over a couple of deadlines. I think you're probably all aware, but before every payroll is processed, a couple of days, we lock the previous payroll period so hours can come over to Oracle for payment. So it's a necessary process that we do. And then on or around the 10th or 11th of every month, payroll goes in and closes all pay periods from the previous month in Time Clock Plus so that there can be no changes to what's already been paid. Just a reminder of the timing when we lock and close TCP. And then I think Jackie has a couple of notes on leave corrections. And then we'll check in on any questions you may have.
Yes, thanks, Kaylee. These other two topics here are just some additional information from the HR website under the Time Clock Plus training modules. So just some reminders about the leave corrections and the timeframes of when those will be entered and processed. And then there is also an import file option. So for those leave corrections that need to be put in a batch can be done via this file that instead of having to enter them in day by day. So when we will share these slides and provide all of you these resources here, and the links are live for you to also see and follow the information to the HR website. Any additional questions on entries, corrections, any of the Time Clock Plus entries can be requested from either HRIS or to navigate them through our HR website. All right. Before I think we actually it might be this will be a good segue too into our next few slides here. Just opening it up again for anyone that has questions. Again, we're here to listen to feedback, to any ideas that you all have as we're processing family, and whatever questions you have. So I'll turn it over to all of you. I don't see anything in the chat currently. So if someone would like to either raise their hand to unmute or to unmute, we can go from there. All right, let's see. I am not seeing or hearing anything for any questions that you all might have. So we'll go into this next slide. So navigating benefits and payroll essentials. This is going to be a reminder that you may all have heard through the HR community meeting as well, but we, through benefits, payroll, and also our well-being teams are committed to providing essentials and trainings and informational educational sessions quarterly. So this is the first in those series. You'll see you may have been even involved in Fabiana's session this morning, which was the Navigating Guidance Resources. And then she will be offering a virtual session tomorrow at 2 p.m. So these were the upcoming sessions. And then we are definitely looking for more information, more topics, more ideas of things that you might all want to hear about that we can approach from a training or a educational perspective. Some may be directed to you all as HR professionals. Others may be directed to our employees. So as we're coming through and coming up with our list of what those essentials are going to be, we'd love to hear from you all as to what ideas that you have too. So
they're looking for our contact information as well.
Yes. So that is probably this slide here. So best resource for you all and even the employees with any family questions, our HR leave inbox is going to be the best option for our benefits team. That can include any family questions. It can include your parental leave, your leave accruals, whatever it may be. And then to the HR payroll team, the HR_payroll is a great resource. And always being able to contact us via the HR service center as well. So 491-6947. So our contact information there. Let's see,
There's a couple of questions.
Okay.
One about top off being higher than an employee's FTE.
Great question.
Possible. Yeah.
Yes. So essentially what occurs with the family calculation is that the wages are reviewed. It really takes the 4 of the last 5 completed quarters and calculates the family wages based upon an employee's highest wages during that period. So it's entirely possible that we may have some employees who would have been full-time or maybe had a higher wage a year ago, and we're now calculating those family hours today. So they get the benefit of the higher wage amount. What that can mean is that if a person was full-time a year ago and now they're half-time, you may receive information and calculation on those entries that is more than their actual FTE. And that is really because those equivalent hours are wage-based and essentially not necessarily always FTE based, because we're trying to get to a maximum of those family hours. So if you ever think there's any discrepancy in those hours, feel free to let us know. We'll do a double calculation, but that can occur, that it doesn't always be equivalent to what their current FTE is.
Can you provide a copy of the full family application the employee submits? Is that online?
So we do, the HR benefits also does receive a copy via email that gets submitted by the employees. If there's particular information that you all may be looking for, we can certainly look at sharing those applications. And as we do receive them in a similar format as to how they're submitted through our web portal or our website, I suppose.
If an employee wants to apply for STD, do they do that as part of their family application?
Good question. The STD processes will be separate. So if they're state classified employees, they can still obtain an application through HR. And then that process can start either at the same time as family, or again, that offset's going to occur, but the application can still be submitted at that time or at a later period. And then the short-term disability on the faculty admin pro side, as we connect with the employees or with you as the departments, we will coordinate that with the need for it. And it may be at the same time, but it doesn't have to be submitted at the same time as the family application. So we'll help coordinate that with both you all and the department, or the department and the employees.
That's all we have in questions in chat.
All right, I'll open it up for one more opportunity if anyone has any questions that they'd like to unmute and share. All right, I'm not seeing or hearing any at the moment. So again, thank you all so much for being with us this afternoon. And again, we just really appreciate you all and everything that you do to help with this process and get our employees paid under FAMLI. All the communication that you have and the education that you've also provided to your employees. And we look forward to working more with you and collaborating with you on how we can make this process the best we can. So thanks so much. And I hope everyone has a wonderful day.
Thank you, everyone.